I'm Dr. Joji.Abraham, an environmental scientist. I'm interested in giving some valuable research based information to reduce the seriousness of the COVID 19 disease if the SARS coronavirus 2 infect you. We all the world, all the countries, whether it is developed, undeveloped, or developing, with all their people, with all their effort, all the money, and all the defense, and all the science and technology, we are currently fighting against a tiny little thing called a coronavirus where we cannot see with our naked eye. We are fighting to get our life back. Until today, on 6th of April morning, so far more than a million people had infected with the SARS coronavirus 2. Around more than 66,000 people lost their life. Most of the people are in lockdown. The world economy is in a crisis and the recession already started across the globe. So, what is our future? Before going to tell the significant thing, I just want to discuss the symptoms that we can see when we are affected by the SARS coronavirus 2 or the COVID-19 disease. It usually starts with a throat irritation, throat pain, cough, fever, myalgia. Sometimes the fever will be very severe with chill and shortness of breath, which is the main symptom of acute respiratory distress syndrome, or what we call ARDS, is the main cause of death in more than 99% of the people who is affected by SARS coronavirus 2 or COVID 19. When our defense mechanism understand the presence of virus in our body, it starts to work to kill the viral particles by creating suitable antibodies. As part of bringing antibodies to the lungs, the body will generate fluids into the alveoli parts of the lungs. And alveoli are the tiny lung area where oxygen and carbon dioxide exchange takes place. Because of the fluid deposition in the alveoli, the proper air exchange, the oxygen and carbon dioxide exchange should not happen, which means our body does not get enough oxygen and the system cannot take all the carbon dioxide out of the body. This creates shortness of breath. That is the symptoms of major symptom of, or what we call it as ARDS. If the body does not get enough oxygen, all the organs will suffer due to the lack of oxygen, and organ death will take place, followed by patient death. This is the situation. This ARDS is the situation where the patient require support and critical care. In most of the people, our defense system works as crazy. Overreaction creates or brings more fluids into the alveoli, which is the main cause of ARDS. If we can avoid this problem, most probably we can save the life of the patients. But how we can do that? That is the main question. I have seen a significant correlation between the presence of vitamin D and ARDS in many studies. For example, one study named vitamin D deficiency contributes directly to the acute respiratory distress syndrome by Dancer et al., published in the journal Thorax. And there are many other studies as well. You open your eyes and look around, you can see that the virus is mostly affecting Europe and the USA, where sunlight is very less. Whereas in Asian countries, most countries have enough sunlight. The virus, the spreading rate of the SARS coronavirus is very low. Of course, it is spreading, but it is slow. Looks at the African countries, it is even slower. Europe and USA are just coming from winter normally, so more than 60% of the population does not have record amount of vitamin D in their body. This may be the increasing severity, hospital rush, and death at the end. One meta analysis study collecting data of various other studies, which include the data of more than 10,000 people, highlighted that in general, vitamin D can provide around 12 percentage protection from ARDS in a normal community. Normal community in the sense all kinds of people with all age groups, all healthy and sick people. But if you take in the subgroups, that means people with comorbidities or people with less vitamin D level in their body, if we correct the less vitamin levels of the people in a separate group, that group will get around 70 percentage protection from ARDS. This is what the study has shown. So what we can do to avoid the seriousness of COVID-19 if the SARS coronavirus infect us? We have to take precautions. We have to make our vitamin D level normal. How we can do that? There are three ways. If you are in Europe and the USA or any place, sunlight is low, look for a supplement. Vitamin D tablet or vitamin D capsules. The second option is consume food containing vitamin D, like dairy products fortified with vitamin D, egg, vitamin D containing fish such as tuna, wild salmon, and mackerel. Third is the best and free option, that is the sunlight. Take plenty of sunlight in the morning or evening. If you are in a high sunny areas like in India or in the Middle East or in African countries, avoid sun exposure during the middays. That means it may create sunburn or sometimes even sunstroke. So it is better to take the solar exposure in the morning or in the evening, or maybe before 10 a.m. or after 4 p.m. Expose your body to the solar radiation to get ultraviolet radiation directly into your skin, and how long it has to take, it depends upon the skin color and the intensity of the solar radiation and how much area of your body is exposing to the radiation. On an average, if the skin color is white, you have to take around 25 to 30 minutes of solar radiation, and if the skin color is brown, go for around 40 to 45 minutes, and the skin color is black, go for around 50 to 60 minutes. That is enough, and it is not for the one day. You have to continue all days. I'm not saying that if your vitamin D level is normal, you won't get SARS coronavirus infection. Rather, I say that if you happen to get COVID-19, the chance of getting the severity become less. If you have vitamin D level, normal level of vitamin D in your body, that means you will get around from 12 to 70 percentage protection, but it also depends on other health problems. And vitamin D is not actually a vitamin, it's actually a pro-hormone. So this is very significant compared to other vitamins. Of course, we need all the vitamins, but most of the people are not talking about vitamin D, and this is free to get. That is the significant thing. No need to go to the pharmacies to buy. If you can buy, you can buy it. Otherwise, you will get freely. So, and every people will asking the same questions: what will be our future? When the lockdown will end? When everything will be normal? Once the famous Indian minister of an emperor named Birbal uh, wrote on the wall, like, this time to pass. That is what I want to say. There are hopes everywhere. The pandemic will actually stop soon. New sun will rise and everything will be back normal. We get new nature far away from pollution, so everything will be new. Let us hope for the best. Love the nature. Thanks and best wishes.